And every time I use those skills, I remember places I'd rather forget. A news story appeared in the local paper. Local family doctor performs life-saving surgery. Dr. Mitchell's quick thinking saves accident victim. The article detailed the emergency surgery doctor, Mitchell's expertise, the life saved, but it didn't mention her Doctors Without Borders background. Patients began treating Dr. Mitchell differently, more grateful, more respectful, more curious. Dr. Mitchell, elderly farmer Frank asked during his checkup, "That surgery you performed, where did you learn that?" "Medical training, Frank. Seemed like more than regular training. Experience comes from various places." Amy noticed Dr. Mitchell becoming uncomfortable with the increased attention. She preferred anonymity, routine, normal family medicine. Thursday evening, unexpected visitor. Dr. James Patterson, Regional Hospital Director, drove 45 minutes to see her. "Dr. Mitchell, I heard about the emergency surgery. Impressive work. Just did what was necessary. That level of trauma surgery, what's your background?" "Various places, Dr. Patterson." "Dr. Mitchell, we're always looking for experienced trauma surgeons. The regional hospital could use someone with your skills." "I'm happy with family practice." "But your expertise, it's wasted on routine checkups. You could save more lives in a trauma center," Dr. Mitchell replied firmly. "I save lives here in ways that work for me." Dr. Patterson left his business card anyway. Think about it. That evening, Amy stayed late to talk with Dr. Mitchell. "Doctor, he's right. Your skills could help more people." "Amy, trauma surgery isn't just about saving lives. It's about being surrounded by death, violence, suffering. I can't go back to that." "But you're so good at it." "Being good at something doesn't mean you should do it forever." Amy was thoughtful. "What if emergencies happen here again?" "Then I'll do whatever is necessary to help. But I won't seek out trauma. I won't return to war medicine." War medicine? Dr. Mitchell realized she'd said too much. Complex medicine, high-stress situations. Amy respected the boundaries and didn't push further. The following week, quiet returned to the clinic. Routine appointments, normal family medicine. Dr. Mitchell preferred this pace. But Amy noticed changes. Dr. Mitchell seemed more engaged, more present. The emergency had reminded her of her capabilities, of her purpose. Saturday morning, another emergency call. Farm accident, serious injury, remote location, ambulance delayed. Dr. Mitchell grabbed her advanced trauma kit without hesitation. "Amy, we're going on a house call. Farm accident scene, worker trapped under machinery, severe crush injuries, possible internal bleeding. Remote location, hospital 90 minutes away." Dr. Mitchell assessed the situation immediately. "Life-threatening injuries. We treat here." She set up makeshift field surgery on the kitchen table. The farmer's wife assisted. Amy supported. Dr. Mitchell performed another emergency procedure, stabilized the patient for transport. "Dr. Mitchell," the farmer's wife said tearfully, "you saved my husband's life." "Just doing my job, ma'am. This isn't a regular doctor's job. This is miracle work." Driving back to the clinic, Amy commented, "Doctor, you seem different today. More confident." "Amy, I realize something. Running from your past doesn't erase your abilities. Skills aren't shameful. How you use them matters." "So you're not ashamed of war medicine anymore?" "I'm learning balance, using trauma skills to help people without returning to a trauma environment. That's wisdom. That's survival." Tuesday morning special visitor, Dr. Emily Rodriguez, Doctors Without Borders Recruitment Coordinator. "Dr. Mitchell, I heard about your recent emergency work. Impressive. How did you find me?" "Your name came up in medical networks. We're always looking for experienced trauma surgeons. I'm retired from field work." "I understand. But short-term missions, training programs, ways to contribute without full deployment." Dr. Mitchell considered. "What kind of training?" "Emergency medicine courses, disaster response preparation, mentoring young doctors." "No conflict zones?" "Domestic programs, teaching others what you know." Dr. Mitchell decided to accept limited involvement, once monthly, weekend training sessions at the regional medical center. Teaching emergency medicine, trauma response, field surgery techniques. At the first training session, 12 young doctors and nurses attended. Dr. Mitchell was nervous but determined. Emergency medicine isn't about heroics, she began. It's about systematic assessment, rapid decision-making, and accepting that you can't save everyone. A young doctor raised her hand. Doctor. Mitchell, what's the most important lesson from emergency medicine? Stay calm. Panic kills patients faster than injuries. How do you stay calm in a crisis? Practice, experience, and understanding that your emotions don't help patients, your skills do. Another participant. Doctor. Mitchell, have you worked in difficult conditions? Brief pause. I've worked where medical supplies were limited, where conditions were challenging. The principles remain the same. Assess, stabilize, treat. The training session was successful. Participants learned practical techniques, gained confidence, improved emergency skills. Driving home, Dr. Mitchell felt different. Purpose without trauma, teaching without reliving, using experience constructively. Amy welcomed her back. How was the training session? Surprising. It felt good to share knowledge without returning to the old environment. You found balance. I'm finding balance. Phone call that evening. The patient from the car accident fully recovered, calling to thank Dr. Mitchell. Doctor, I want you to know, you saved my life. My family will always be grateful. I'm glad you recovered, Mr. Williams. Doctor, whatever training you had, thank God you were there. After the call, Doctor, Mitchell reflected, 30 years of hiding from her medical past, now slowly integrating experience with her present mission. Medical journals arrived monthly. Dr. Mitchell began reading again. Trauma surgery advances, emergency medicine innovations, field hospital improvements. Amy noticed the change. Doctor, you seem more complete. Amy, I spent years trying to separate who I was from who I am. I'm learning they can coexist. 6 months later. Riverside Family Clinic was busier than ever. Word had spread about Dr. Mitchell's expertise. Patients traveled from neighboring towns for quality medical care. The office wall now displayed an additional certificate, Emergency Medicine Instructor, Regional Medical Center. Dr. Mitchell still treated routine family medicine, flu shots, checkups, minor injuries. But when emergencies arose, the community knew they had exceptional care. A young medical student visited for rural medicine experience. Dr. Mitchell, what's your advice for future doctors? Medicine isn't about prestige or recognition. It's about serving people where they need help most. What if we want to work in challenging conditions? Then prepare thoroughly, stay humble, and remember, your job isn't to be a hero. Your job is to heal. That evening, Dr. Mitchell updated her photo display. She added a recent picture, regional medical training class, teaching trauma techniques to the next generation. The old war zone photos remained but were no longer hidden, part of her journey, not the definition of her destination. The phone rang. International number. Dr. Mitchell hesitated, then answered. Dr. Mitchell, this is Dr. Rodriguez. We have an emergency situation. Need experienced trauma surgeon consultation. Remote guidance only. No travel required. What's the medical situation? Field hospital, limited supplies, multiple casualties. Need surgical advice. Dr. Mitchell considered. Remote consultation, sharing expertise without physical involvement. I can provide guidance. Send the patient information. 2 hours later, successful remote consultation. She guided field surgery via video call, saved lives without leaving Montana. Amy found her afterward. Doctor, you helped people tonight. Yes, but on my terms. Using experience without sacrificing peace. Perfect balance. Getting closer to balance. Real healers don't retire from helping people. They find new ways to serve, new methods to share knowledge, new balance between past experience and present mission. Dr. Sarah Mitchell learned that healing trauma doesn't require forgetting expertise. It requires choosing how to use knowledge wisely. Sometimes the greatest doctors work in the smallest places. Sometimes wisdom comes from integrating all parts of yourself, and sometimes helping others heal helps you heal too. So now I ask you, have you ever met someone like Dr. Mitchell? Someone who used extraordinary skills in ordinary jobs, serving while hiding their past? Share their name in the comments. If you like this story, subscribe and share. Help us make sure those who provide great service in small places, the silent healers, are never forgotten. Nobody questioned why Dr. Sarah Mitchell always stayed so calm during medical emergencies, or why her eyes had that distant look when helicopters flew overhead, or why she kept certain surgical instruments that seemed too advanced for a rural clinic. To her patients, she was just their trusted family doctor. What they didn't know was that those same steady hands had once operated under sniper fire. Before we dive into this powerful story of hidden expertise and unexpected revelation, tell me in the comments which city you're watching from. And if you believe stories like this deserve to be remembered, hit that subscribe button. Because sometimes the greatest heroes hide in the smallest places. Dr. Sarah Mitchell had been working at the same clinic in Riverside, Montana for 30 years. 52 years old, medium height, brown hair mixed with silver, eyes that held a gentle but watchful expression. Riverside Family Clinic was the town's only medical center. The nearest hospital was 45 miles away. The town's 2,800 residents loved Dr. Mitchell. She handled everything from deliveries to elder care, flu treatments to broken bone sutures. Her office was old-fashioned, wooden desk, vintage examination table, medical diploma on the wall, and a few family photos. Only the photos' origins were unclear. "Morning, Dr. Mitchell," postal worker Betty would say each morning. "Morning, Betty. How's that knee?" "Much better, thanks. Those exercises are working." "Good to hear. Come see me if it bothers you again." Dr. Mitchell remembered every patient, not just their medical conditions, but their families, jobs, and concerns. Personal touch was the foundation of small-town medicine, but nobody noticed that her medical knowledge was unusually extensive for a rural practice. In her examining room were some unusual instruments: advanced surgical tools, trauma kits, emergency medications, more than a typical family doctor would need. Dr. Mitchell's explanation: "It's important to be prepared for emergency situations." Office manager Helen sometimes noticed strange things about Dr. Mitchell's behavior. When she heard helicopter sounds, she'd pause slightly and look into the distance. When war movies played on TV, she'd change the channel. And when the phone rang with international numbers, she never answered. "Doctor, how did you make that surgical scar so perfect?" young nurse Amy had asked once. "Practice," Dr. Mitchell's simple answer. "What kind of practice?" "Old practice." Amy hadn't asked further. Dr. Mitchell was friendly but private. She spoke little about her past and gave brief answers to questions. Tuesday, April 15th. Spring weather was beautiful in Montana. Dr. Mitchell began her normal routine. Clinic opened at 8 a.m., first patient at 8:30. Mrs. Johnson, 67 years old, diabetes checkup. "Blood sugar levels are good, Mrs. Johnson. Continue your medication." Billy Thompson, 12 years old, bicycle crash. Minor cuts, bruised knee. Dr. Mitchell cleaned the wounds, applied bandages, updated his tetanus shot. "Dr. Mitchell," Billy asked while being treated, "have you ever seen really bad injuries?" Pause. Dr. Mitchell's hand stopped momentarily. "Everyone gets hurt sometimes, Billy. The important thing is proper treatment." "But like, really bad injuries? Like in movies?" Dr. Mitchell resumed bandaging. "Movies aren't real, sweetheart. Focus on healing this knee." During lunch break, Dr. Mitchell remained alone in her office. She opened a locked drawer. Inside were old photos, faded medical ID cards, letters in foreign languages. One photo was especially meaningful: a makeshift hospital, war-torn building, medical team in scrubs. Dr. Mitchell among them, younger, with a different expression. Intense, focused, battle-hardened. 1:30 p.m., afternoon patients began. Normal routine, cold symptoms, prescription refills, routine checkups. This was Dr. Mitchell's preferred pace: predictable, safe, controllable. 3:45 p.m., emergency call. Car accident on Highway 2, multiple injuries, ambulance ETA 20 minutes to clinic before hospital transport. Dr. Mitchell immediately went into preparation mode. Amy, prepare trauma kit A. Helen, clear examination rooms 1 and 2. Call the hospital, alert them about incoming casualties. Trauma kit A. Amy was confused. We don't usually. We do now. Move. Amy noticed Dr. Mitchell's demeanor had completely changed. Voice authoritative, movements precise, energy different. Not the gentle family doctor anymore. Something else. 4:15 p.m. Ambulance arrived. 2 casualties. Adult male with severe lacerations and possible internal injuries. Teenage girl with head trauma, unconscious. The paramedic began his report. Adult male, steering wheel impact, possible internal bleeding. Teenage passenger, head impact, Glasgow coma scale. I've got them, Dr. Mitchell interrupted, taking charge immediately. Dr. Mitchell directed the adult male to examination room 1. Amy began assisting, but was surprised as she observed Dr. Mitchell's technique. This wasn't standard family practice methodology. Amy, start an IV line, normal saline wide-bore needle. Check blood pressure every 2 minutes. Dr. Mitchell conducted a rapid systematic examination of the patient. Her hands were professional, movements efficient, eyes focused. Her abdominal palpation technique was advanced trauma assessment, not routine checkup. Possible splenic rupture, Dr. Mitchell muttered. Amy, call the hospital. Tell them to prepare the OR for emergency laparotomy. Patient needs immediate transport. Laparotomy? Amy had never heard Dr. Mitchell use such advanced surgical terms. Abdominal surgery. Move. Dr. Mitchell focused on the teenage girl. Her head trauma assessment began with neurological testing, pupil response, reflexes, consciousness level. Again, her technique was advanced trauma protocol. Significant concussion, possible subdural hematoma, neurological monitoring is critical. Dr. Mitchell, Amy whispered, how do you know all this? Not now, Amy. The adult male patient's blood pressure was dropping, signs of internal bleeding increasing. Hospital transport was 25 minutes away. Standard protocol, stabilize and wait. But Dr. Mitchell made a decision. Amy, prepare surgical instruments. Sterilize examination room 1 inch. Surgical instruments? Doctor, we're not equipped for surgery. Dr. Mitchell turned, eyes intense. Amy, that man will die before reaching the hospital. We operate here. We can't perform surgery in a family clinic. I can. Dr. Mitchell's voice carried authority Amy had never heard before. Command presence from a different time, different place. Amy, either help me save his life or get out of my way. Amy decided to trust her. Dr. Mitchell transformed completely. No longer the gentle family doctor. A professional surgeon, combat-tested, life-saving machine. Emergency surgery began. Dr. Mitchell's hands moved with precision Amy had never witnessed. Perfect incision, flawless technique, extensive knowledge. This was textbook trauma surgery, performed in a small-town clinic. Amy, suction here. Clamp that vessel. Good. Surgery lasted 45 minutes. Dr. Mitchell identified the internal bleeding, repaired the damaged spleen, stabilized the patient. Professional, efficient, life-saving. Patient stable. Hospital transport can proceed safely. Amy stared in amazement. Dr. Mitchell, where did you learn to do that? Dr. Mitchell was cleaning up, back to her normal demeanor. Medical school. No, that wasn't medical school. That was advanced trauma surgery. Military level. Long pause. Dr. Mitchell considered her response. Amy, sometimes experience comes from places you don't talk about. The following day, word spread around town. Dr. Mitchell had performed emergency surgery, saved a man's life, unusual for a family clinic. People were curious, grateful, amazed. Amy couldn't stop thinking about it. That night, she did internet research. She searched Dr. Sarah Mitchell combined with trauma surgery and military medicine. She found an interesting result. Dr. Sarah Mitchell, MD, Doctors Without Borders, 1995 to 2010, Syria, Afghanistan, Somalia, Rwanda, trauma surgeon, conflict zones, humanitarian missions. The next morning, Amy confronted Dr. Mitchell privately. Doctor, I found some information online. Dr. Mitchell looked up from her patient files. What kind of information? Doctors Without Borders, conflict zones, trauma surgery? Long silence. Dr. Mitchell closed the file and leaned back. Amy, what do you want to know? The truth. Where did you learn to operate like that? Dr. Mitchell walked to the window and looked out at the peaceful Montana landscape. 15 years, Amy. Doctors Without Borders, war zones, refugee camps, places where medicine means life or death every day. Syria? Among others. Afghanistan, Somalia, Rwanda, wherever people needed medical care and no one else would go. Amy processed the information. Why did you leave? Burnout, PTSD, survivor guilt. After 15 years of battlefield medicine, I needed peace. So you came here. The smallest, quietest place I could find, where medical emergencies meant flu shots and broken bones. Amy understood. Until yesterday. Until yesterday. Dr. Mitchell sat down, sharing her full story for the first time. Amy, in war zones, you operate under impossible conditions. No electricity, limited supplies, bombs falling, casualties coming faster than you can treat them. That must have been terrifying. It was necessary. People needed help. Why don't you tell people? The town would be so proud. Dr. Mitchell shook her head. Amy, I came here to forget, not remember. To heal people without violence, without trauma, without death surrounding everything. But your skills saved that man's life.